With those announcements made, I'd like to thank everyone for being here today. Our webinar today features two VA programs, the VA Office of Tribal Government Relations and the VA Rural Interdisciplinary Team Training Program. Today's webinar is the last of a three-part series on veterans and LTSS. In this series, we've learned a lot about different ways that VA, the Department of Veterans Affairs, works with individual veterans who may be eligible for services or benefits. That was part one. And how VA works with communities, such as the tribal communities of the Navajo and Hopi nations, who collaborate with the Northern Arizona VA healthcare system to bring VA care to highly rural areas. That was the webinar part two. Today we're featuring two programs that have a special tribal focus. RIT is a program to improve care for older veterans that has begun working with IHS clinical sites, and we'll have a brief introduction to that program to start with. And then we'll have a panel discussion presented by VA's Office of Tribal Government Relations, the department within VA whose job it is to facilitate VA's relationships with tribal nations to better serve veterans in Indian country. To begin with, I'll turn it over to Dr. Josie Kramer to tell us about the Rural Interdisciplinary Team Training. Dr. Kramer?
Hi, everyone. Thank you for letting me tell you about this program today. I'm Josie Kramer. I'm one of the directors of a VA Geriatric Research Education and Clinical Center. And as you can probably hear, I have a cold, so I hope you can hear me clearly. I do feel a bit like one of Snow White's dwarves today, sneezing, not grumpy. I'm the director of the VA Geriatric Scholars Program, and that's a program that aims to integrate geriatrics into primary care practices throughout the VA, particularly in the rural clinics. It has a number of components to it, but one particularly caught the eye of Bruce Fink from the IHS Elder Care Initiative and invited us to provide our Rural Interdisciplinary Team Training Program, I'll call it RIT for short, as two Indian Health Service and tribal health programs. It's part of the IHS strategic plan to address Alzheimer's disease in Indian country. We offer the program to both Indian Health Service and tribal health programs. RIT is accredited for CMEs and CEUs, and it's a very interactive program. It involves the entire team, not just clinicians, but also non-clinicians in the community. So, yes, primary care providers, social workers, psychologists, pharmacists, but also it's important that the clerks and health educators participate, public health nurses, CHRs, and anyone in the community who is interested in health care can also attend if there's a health committee or someone from an elder's health social program. This is a highly interactive learning program. It's a full-day program, and you can see on the slide the key topics. Class sizes are small because it's interactive, so 8 to 30 people. We are funded very generously by the VA Office of Rural Health to offer 10 programs a year at no cost, the Indian Health Service or tribal health programs. There's 10 programs in the lower 48. We have a few more slots open. It's first come, first served. And this year we're also providing the RIT program to the Aleutian and Pribilof Island Clinic. If you'd like to know more information or get on the schedule for this year or plan it for next year, please contact Eve Dottersman at va.gov. She can be reached at the phone number on your screen, 718-584-9000, extension 3813. Can I answer any questions about the program?
So if you have a question about the RIT program, go ahead and type it into the Q&A box at the bottom right-hand corner of your screen. We'll pause for just a moment to see if there are any questions. Okay, I'm not seeing any come in just now. So, Dr. Kramer, I'd like to thank you for joining us and for giving us that brief introduction. We've got the contact information that you supplied in the top right-hand corner box. So, for the audience members who might need information on the RIT program in the future, be sure to reach out to Eve Gottesman if you have additional questions. Dr. Kramer, thank you so much. Now, we'll turn our attention to the VA Office of Tribal Government Relations, or OTGR. We're so glad today to have the entire OTGR team with us for a panel discussion. It's especially important because they're the contacts at VA that can help you with anything. They can help you find answers about health care and benefits for veterans in your community, but they can also help with a great number of other topics. And they'll be talking today about the wide range of work that they do in each of their regions. So I'd like to turn it over now to Stephanie Birdwell, the Director of the Office of Tribal Government Relations, for an introduction to this office. Stephanie, go ahead.
Thank you, Sarah, and good morning or good afternoon, depending on which time zone you're listening into this webinar from. But as Sarah mentioned, I'm Stephanie Birdwell, the Director of VA's Office of Tribal Government Relations. I'm an enrolled member of the Cherokee Nation of Oklahoma, and it's an honor to be here with everyone today. I'll share with you just a little bit about the role of the OTGR, as we like to call it, from sort of a national perspective. We are the Office of Tribal Government Relations is part of the Office of Public and Intergovernmental Affairs, and we're based in Washington, D.C., but we have a field presence, and you'll be able to hear from our Tribal Government Relations specialists here in just a moment a little bit more about the work that they do. The OTGR was established just over 6 years ago. We are the staff office responsible for advising the Secretary on all matters affecting VA's relationships with tribal governments. Our team focuses primarily on three areas: facilitating tribal consultation on behalf of the Secretary, engaging and supporting activities that result in increased access to care and benefits for veterans across Indian Country, and promoting economic sustainability for veterans living in Indian Country. We believe that by working to ensure veterans access benefits they've earned through their service will improve the overall quality of life for our veterans, their families, and communities. I'd like to drill down just a bit more into these three primary areas of focus. Regarding the topic of tribal consultation, in 2016, VA consulted on topics ranging from consolidating how VA purchases care in the community to amendments to Title 38, Part 14 that would add tribal departments of Veterans Affairs as entities, such as state departments of Veterans Affairs, that may accredit veteran service officers or that can seek veteran service organization status, all the way to asking tribal leaders to identify the top 3 to 5 priorities for veterans across Indian Country, which is what you're looking at right now. These are the results from that last consultation regarding the 3 to 5 priorities. As you can see, and I know that the print here is small, the report that's forthcoming, the print should be a little bit easier to read. But as you can see, many of the priorities are consistent with the priorities of all veterans, particularly rural veterans. But a recurring theme we saw was that it was important to tribes that VA really respected and incorporated culturally competent ways of working with tribes and engaging the veteran population. Conversely, an area that our team tries to focus on is working on providing technical assistance to tribes in the area of becoming veteran-centric. So tribes also understand the sometimes unique culture and preferences veterans have when receiving care or communicating with someone who may best understand their experiences and perspective as a veteran. So basically building bridges so that VA and our service providers can become tribal-centric, if you will, and informed, while at the same time our tribes can become veteran-centric and very effective and proficient at serving our vets. At the second area of focus, when it comes to the topic of access to care and benefits, our office works very closely with the VA Office of Rural Health, whose leadership works closely with the Indian Health Service on the application and implementation of the VA IHS MOU. The VA IHS MOU is a book with different chapters of possible collaborations focused on serving veterans, one of which is the reimbursement agreement program that many of our audience members may be familiar with, where VA reimburses Indian Health Service and tribal health programs for providing direct care to veterans. Other chapters in the MOU book, if you will, include, as you can see, mental health, telehealth, pharmacy, innovative ideas for increasing access to benefits, and others. The third area, and I mentioned it just a few moments ago, is economic sustainability, and you'll hear more specifically about this topic from our specialists here in a moment. But we like to emphasize with tribal leaders and service providers how encouraging veterans to access and use the benefits that they have earned is a win-win for both the veteran and the local community. So that is a national perspective on who we are, where we fit within the VA, and what our focus is. Although we are based in D.C., we have 4 tribal government relations specialists based in the field who are responsible for managing a portfolio of relationships with tribal governments located within a defined geographic region. I also want to point out, you're seeing this image here, that Clay Ward is our colleague here in the D.C. office, and he works with us as a program analyst. The other 4 tribal government relations specialists are field-based. So with that, I'd like to go ahead and turn the discussion over to our regional specialists, who will share with you the work they do at the local level to assist tribes and the VA to work collaboratively to reach and serve our veterans. I'll turn it over to our team now.
Let's actually begin.
Clay, do you want to introduce yourself?
Yes, I can go ahead. This is Clay Ward. Good afternoon and good morning. My name is Clay Ward, and I'm a member of the Choctaw Nation of Oklahoma. I'm a program analyst, as Ms. Birdwell mentioned, in the Office of Tribal Government Relations, and I am based in the Washington, D.C. office. I provide program and administrative support to Ms. Birdwell and to the program's government specialists in the field. Thank you.
Terry, go ahead.
Hello, everyone. It's an honor to be a part of this webinar. My name is Terry Bentley, and I'm an enrolled tribal member of the Karuk tribe from Northern California. I'm physically located on the VA campus in Roseburg, Oregon. I have worked for a VA for about 30-plus years. My father was a Navy veteran, my grandfather a World War II Navy veteran, my father-in-law is also a Korean veteran, and I kind of come from a family of veterans, many uncles who are veterans. It has been my great privilege to serve veterans and their families during my career. My region covers approximately 6 states along the Pacific District, the green area that you see on the webinar. About 404 tribal governments are within my region, and approximately 70% of the tribes nationwide are within my region. Thank you, and look forward to talking with you today.
Hi, everybody. My name is Peter Vicaire. I'm from Musketish Mi'kmaq First Nation, which my reservation is up in Canada. I'm also a U.S. Marine, and I work with OTGR. I'm in Minneapolis, and my region covers 74 tribes in 14 states, the northern tier, all the yellow states you see up on top of that map there. Thanks for dialing in and listening.
Hello, my name is Helena Pawiki. My first name is Lorraine, so if you email me, it will be lorraine.pawiki@va.gov. And I have the honor of working with veterans in 4 states that are referred to as often the 4 corner states: Arizona, New Mexico, Colorado, and Utah. And I am Hopi and Navajo, and I have approximately 52 tribal governments. And I also work with the Isleta del Sur in El Paso, Texas.
Hello, this is Mary Cully, and I am a Seminole Creek Indian out of Oklahoma. I am enrolled with the Seminole Nation of Oklahoma. I'm also a 20-year Air Force veteran, and my office is stationed out of Oklahoma City, directly across from the Oklahoma City VA Medical Center. I service 55 tribal nations within my region, which is actually from Kansas through Arkansas over to North Carolina, down to Florida over to Texas and back up. I also have been with the VA myself just a little over 12 years. Thank you for calling in on our webinar today.
Thanks, everyone, for the introductions. We'll move into our panel discussion now. We've got 4 main topics and a chance for all of the OTGR staff representing their regions to tell us what these topics look like in the tribes, the states, and the regions that they work with. Beginning with demographics and economic sustainability, we know that veterans and VA expenditures can be real economic drivers in communities. Hamana, talk with us about the data that we see here for VA expenditures in your region in the counties of the Navajo Nation.
Thank you. What you're seeing is actually the economic impact that veterans provide to local, regional, state, and when you add this up to the rest of the counties in the United States nationally, what they contribute economically is quite powerful. And so you see there in the light blue box, it says total expenditures, $979 million. That is the sum of all of the numbers that are in that table. So, and that is for fiscal year 2015. So that is a dynamic number. It changes yearly. It changes probably daily as veterans enter the system and either gain medical care or submit a claim for compensation and pension, and there's an award for that. There's also education benefits that are accrued. So you can see there the sum of the pie at the bottom shows the different areas that are represented. So the compensation pension represents the biggest portion of the pie, and the medical is quite near that, but it also is quite significant. So then over on the 2 boxes that are in yellow, you can see that for all the veterans for these 10 counties, we have, the VA has recognized 105,462, and that means those veterans have come to VA, enrolled in VA, either in the health administration or the benefits administration, and probably are also receiving benefits from the cemetery administration. And then if you were to divide the number of, the 105,000 into the total expenditures of $979 million, you get a per capita or per veteran expenditure average of over $9,000. So this really shows the this information. The VA puts this out regularly, and the payoff is significant. There are more dollars to individuals, to families, and to communities. So what we did was the data is available at the county level, and then we then extrapolate, the American Indian, Alaska Native population percent, which isn't on this slide, but we have that information, as well as the percent veteran representation of the 10 counties, and then we kind of extrapolate from there in terms of what that economic impact would be. But it does go to show you that enrollment and participation in the VA, in its health care, in its benefits program, is very important because it's money that comes from the VA to veterans, and which has impacts at the family level, the community level, the nation, tribal nation level. And I want to add that all of my colleagues have this information for their areas as well. Lastly, I want to include that I included the Navajo Nation as being the kind of example here, and Navajo Nation has also been very active in the reimbursement agreement program that is through the Veterans Health Administration, and so all of their health care facilities, the Indian Health Service and the Tribal Health Program facilities, have reimbursement agreements that are established with the local VA medical centers. There is also a vet center located on the Navajo Nation. It was the second vet center placed on a tribal land base. And there's also, there's very innovative practices occurring at several facilities on the Navajo Nation. So in the facilities of the Chinle Comprehensive Health Care Facility and the Tuba City Regional Health Care Corporation, which is the 638 facility, both of those have internal veterans clinics embedded within the Indian Health Service facility or the Tribal Health Program facility. So there's really some important aspects of their involvement with VA. Thank you.
Thanks, Homina. Hi, everyone. This is Terry again. And contrary to what Homina just described and the economic impact that veterans have within the communities of Indian country, recently Stephanie Birdwell and I had the opportunity to attend the National Center for American Indian Enterprise Development annual RES 2017 conference in Las Vegas. And the importance of that particular event is the work that our office does in helping veteran-owned small businesses and service-disabled veteran-owned small businesses understand the opportunities that are available to them through VA federal contracting. We work closely with the Office of Small and Disadvantaged Business Utilization, which is responsible for working with small businesses, and in particular veteran-owned small businesses, and the work in obtaining work with the VA federal government. And for the first time ever, VA awarded more than $4 billion to service-disabled veteran-owned small businesses and veteran-owned small businesses in fiscal year 2016. That's a fairly substantial accomplishment. Thank you.
Hi, this is Peter. I'd also like to jump in at this point, and just to bring up the topic of veteran service officers. They're very important. Veteran service officers. The acronym is VSO. So VSO is essentially it's a person who helps veterans with their needs. They're trained and accredited, and they're liaisons that help veterans identify and navigate. There's a lot of different federal, state, and local programs and resources and benefits available to them. So the VSO helps them navigate through all that stuff. The VSOs are trained and accredited by veteran service organizations, which are previously recognized by the VA. So while they in the present they direct veterans to services that they need, they can also file claims for retroactive compensation for veterans that are eligible. So having a VSO or a good one is not only immensely beneficial for veterans on the reservation, but also it's helpful for the reservation or community itself, because it can be sometimes a large infusion of money into the local economy. There's one veteran service officer in particular I'm thinking of, Kerry McDoxson. He's out of Oneida, Wisconsin, and his office, him and his staff, they've been dealing with some pretty big retroactive payments. There's one just recently that was $417,000, and a few also in like the $180,000 range. I just spoke with him recently, and he said that just 2 weeks ago, he helped a non-native veteran. I mean, his office is so effective that people come from off the reservation, come and work. They prefer to work with him because he's so effective. So this non-native received $64,000 in retro, and there's a lot more numbers tossed around. But the point is that having a good VSO in place is really could be helpful for economic sustainability. And that's not to also to exclude when a veteran is identified as 100% service connected. The veteran also receives about $3,000 a month regularly. So if a tribe wants to get a VSO or a TVSO, Tribal Veteran Service Officer, there's a few ways they can do it. They can send an identified person to attend training to get certified to a state, or there's something, the National Association of County Veteran Service Officers, or there's a national organization that they can go through, American Legion, DAV, VFW. There's several. There's a lot more. So they could do that route. But just recently, actually just yesterday, March 21st, tribes are now eligible to, they have the ability to apply to become a veteran service office themselves, just like a state or a county or national office that does this. So they still have to meet all the same stringent requirements that other entities do, but when they do it, they can actually accredit their own officers and have them in place. So if a tribe, having a good motivated TVSO it's really critical into tapping into some of this economic opportunities that veterans have.
And Peter, this is Stephanie. I'd like to just interject also that on the topic of tribal health or Indian health service facilities becoming vet-centric and related to veteran service officers, it's probably not a bad idea for healthcare facilities across Indian country to have a veteran service officer, to know who the veteran service officer is at the local level, and to possibly have service officers hold office hours within tribal or Indian health service clinics, because that's a very important point of access, again, not just to healthcare, but to all of the other financial benefits that Peter just spoke of, and Terry and Homina and all of our colleagues as well. So something to consider, know who your service officer is in your tribal community, and consider having them to hold office hours at the healthcare facility.
I've got a question from the audience related to the information that you spoke about, Terry. Libby Watanabe asked, for the VA small business support provided last year that you explained about, were the funds provided as grants or as loans?
No, those were actual contracts that those service-disabled or veteran-owned small business received from the VA for procurements and services. So that $4 billion is for actual contracts for, a procurement for supplies, construction, architectural engineering, or other services and products for the VA.
Great, thank you. Let's move on to trends and priorities. What are some of the emerging trends that each of you see in your regions relating to serving veterans or working with VA?
I'd like to say that I think tribal communities, people in tribal communities, in the healthcare facilities and in tribal departments are becoming more aware of their veterans. Tribal nations have always regarded veterans highly, and now there's been a lot learned about what a veteran is and what earned benefits accompany that status if they're honorably discharged from the armed forces. So that's been very, very good for myself, because that growing awareness helps the work that I do be more easily understood.
Hi, this is Mary. For me, in my region, I know a lot of the recent trends that I've noticed is really in the way that tribal staff that attend a lot of our events, it's in how they ask their questions now related to the various VA programs that they might be interested in for their tribal populations. When we first started out, they had the question, and you could see the question in their face, but they weren't quite sure how to bring the question out. But now, as over these last few years, their questions seem to be more thought out in how they ask it, plus their understanding and their knowledge as they work with not just local VA staff, but with our office. It's grown tremendously because it's obvious they're doing their research in terms of how specific programs work for the veterans they service within their own tribal programs, whether it's housing, whether it's healthcare, education. You see the difference. I will say that the various trainings and information and sharing events that we help get put together, whether it's like attending a health fair at a tribal healthcare facility, whether it's doing a stand down, whether it's doing an enrollment fair with a healthcare facility, regardless of the type of event that we help put together, I honestly feel it's been very beneficial and very helpful to tribal staff that routinely participate in these events. And what makes that so great is that, because that tribal person who's assisting that veteran or even that widow within your own community, you're not only providing key needed services and resources to your veterans and widows, but you are also helping us as VA provide you with better options for resources for assistance. Because as you connect with us, whether it's with the OTGR team or with your local VA rep, you're helping establish that strong collaborative working relationship between us, and the vet sees that. So when the vets see that, the widows see that, they're more apt to engage and start asking questions about what they've earned the right to have as well. That's huge. In terms of priorities, I know for my region, I often see and I hear a lot of requests about information geared towards their homeless veteran population, mental health. I get a lot of mental health questions, especially from clinicians who are really interested in understanding what that relationship and that treatment that VA provides as it relates to post-traumatic stress and traumatic brain injury for veterans. Because, as we've increased and improved on the reimbursement with our tribal health and our Indian Health Service facilities, the number of veterans requiring mental health treatment for those kinds of conditions has readily increased within those tribal health care facilities. So that's a huge one that I see that's been coming up quite a bit. Home repair issues is another trend that's starting to surface. The VA has the what we call the SAH grant program. It's a special adaptive housing grant program, and it's really connecting, again, tribes with a local veterans benefits rep who understands what that program is, helps vets with application for that, and it basically is a renovation grant for a home for a vet so that they can make their home more handicap accessible. So those are some of the things that we're seeing as well. Widows benefits is really starting to surface as well. Another trend that's starting to pop up is trying to understand exactly what widows are eligible for and getting the widows comfortable enough to come out and say, ask questions, because a lot of our Indian widows, they know their husband served, but that was theirs. They never questioned it. They never asked anything about it. And with our elders, they tend to keep it to themselves. But within our widow population, it's important for us to also engage them and get them to understand that they are also eligible for benefits that they might not know they're eligible for. So helping with that piece, it's huge. And then lastly, and I see this pretty much everywhere, transportation. Transportation is definitely on the forefront for everyone that I tend to work with in terms of how they can help get their veterans to their health care appointments as well.
Great. Thank you, Mary. I have a request from the audience, and it's a good one, I think. Can I ask the OTGR speakers, when you begin, to please give your names so we can easily recognize who's speaking and recall what region you're from and make sure we understand who's describing what. Related to the priorities discussion, we're getting some comments in that are strongly tied to what you all are already discussing. One audience member says, within tribal health, veterans have difficulty gaining access to critical health care services due to their remote location or lack of transportation, like Mary was just explaining. My question is, have other regional specialists seen this come up in your regions, and do you have any comments on that?
Well, this is Mary again. I know from my region, it does continually come up, and within the facilities, the local VA facilities, they tend to have what they call tribal liaisons. Some of them call them Native American nurse navigators. There are different names for them that work within those facilities. So it's important for your tribal health care or your IHS facility to make that connection with that individual, because a lot of times they can serve as the case manager for whoever that individual veteran is that gets health care at that facility, and it depends on the VA facility and how they work their program as well. But once you make that relationship and that connection, that would be the person that you could go to help if there's a way to try to help with looking at what the needed services are, work with the local doctors that are there to see, what kind of walls or barriers are existing for that particular veteran, where they can assist them as well. And it's really coming down to the local VA rep and the IHS or the tribal health rep really coordinating what that individual Indian veteran needs in terms of those gaps that exist for their health care with VA.
And this is Stephanie, just to kind of piggyback onto what Mary said, or almost just to sort of affirm what she said. If you also are having difficulty or issues for whatever reason with your local VA or with care coordination, it's perfectly fine for you to reach out to any one of the regional specialists that would be working with tribes or your tribe within your region to kind of help facilitate those communications. We won't get too deeply into it because again, it may be it may be very important to kind of have very specific conversations about your particular tribe, the location, and so on. But of course, VA does also, in addition to provide care in its facilities, it purchases care in the community from IHS and from tribal health from IHS and tribal health programs, but also has quite an expanded, if you will, robust, if you will, care in the community program, so that many specialty providers that historically tribal health programs or IHS health programs have used VA may now be purchasing care from those providers. So I guess the takeaway is it's important to communicate, to really find out what is actually available, because there may be a perception that VA is far away and doesn't have local resources, so it may be a matter of needing more information and greater awareness because things have changed quite dramatically over the last few years, specifically with VA's strong emphasis of delivering care in the community and closer to home. So as Mary said, definitely be communicating with your closest local VA, but when in doubt, or if you're just kind of thinking, how would I even begin that conversation or determine where to start, please feel free to reach out to any one of our team, and most specifically to the tribal relations specialist who works in your region.
Thanks,
Hi, this is Terry. I just want to echo what Steph said, and I think from my experience in my region, that is often what I'm doing is helping be a conduit and a facilitator and provide that network to one of the three branches that are needed in the way that we helping make those bridges and connections for the tribe to the appropriate VA branch. And then the only other comment I wanted to make about as far as trends and priorities, more female veterans are serving in the military now than ever, and in particular, more American Indian Alaskan Native women are serving actually in the highest numbers than any other ethnicity. So I think we're really seeing a trend towards how are we going to reach out to those individuals so that as the Oregon State Department of Veterans Affairs has a slogan that says, "I am not invisible," how are we going to make sure that those individuals receive the care and benefits that they so richly deserve as well? Thank you.
Thanks, Terry. Let's move on to the topic of building partnerships. And I know that supporting partnerships and connections is one of the key pieces of the work that each of you do to make sure that the right people and the right organizations get connected. Steph, for this topic, can you start us off with some thoughts about what this has looked like generally and historically for VA?
Sure, Sarah, absolutely. And I'll specifically talk about when our team starts to talk about partnerships, of course, we'll talk more broadly about partnerships with different federal agencies, tribes. There's a wide field, if you will, of different entities to partner with when it comes to veterans issues. But specifically, I wanted to interject and mention regarding the relationship between tribal governments, the VA, and state governments, we do understand that those relationships between tribes and states can be complex, and there can be some reluctance by tribes to engage with states or state entities. I just want to offer that we've found when it comes to veterans issues, state directors of Veterans Affairs and state leadership has been very supportive and willing to engage on a government-to-government basis with tribal governments in terms of outreach and creating awareness of what unique programs or services may be available from states to all veterans, including Native veterans and their families. We've had state Veterans Affairs directors accompany us on intergovernmental site visits, help sponsor veterans training summits that VA has held in partnership with tribal governments, and we've had also some state directors even required that state veteran service officers communicate and partner with tribal veterans representatives before they will even fund their own state veteran service officers. So the states that we work with that have a tribal government presence have been very supportive. So I just wanted to offer that we understand there may be a reluctance, but in our experience between states and tribes on Veterans Affairs issues, the experience has been generally quite positive. So our listeners might not count states out when it comes to partnerships. That's not the only partnership by any means, but we just wanted to interject that might be something worth keeping on the radar, that historically folks may have been reluctant to pursue those conversations.
Yeah, this is Peter. Piggyback on what Stephanie said, I guess that comes into play with that rule change that I just mentioned earlier. It's a change in 38 CFR 14.628. Now, what that was it was an enumerated list of entities that could be accredited by VA to serve veterans. So with that change that just came into effect yesterday, now tribes can become their own VSO, their organization. But kind of a beneficial offshoot that happened because of that is that some states who just recently went through the process themselves, and they know how long and arduous a journey it was. I'm thinking Washington State and Michigan, both the state folks there offered reach out to tribes in an effort to say, hey, look, if you don't want to go that route and if you want to partner up, we're here for you. So I'm thinking that more states will come out as well, but as of right now, Washington and Michigan both just recently reached out to tribes to work with veterans to accredit somebody the tribe identifies as who they want as a veteran service officer, and to train them for free and get them working for the veterans on the reservation.
Hi, this is Terry again. I've been very fortunate within my region in collaborating with my state partners that have worked with us for tribal veteran representative and tribal veteran service officer training in collaborations with the Oregon State Department of Veterans Affairs, the Washington State Department of Veterans Affairs. I've also had collaborations with the Alaska State Department and the Idaho and Nevada State Departments. And just recently returned from the California State Department of Veterans Service Officers training, where CalVet is very interested in partnering with tribes as this new final rule has been published in the way of helping training with tribes, partnering, being a resource to tribes as needed in moving forward. And I just want to put in a plug that our tribal vet reps and our tribal veteran service officers are so extremely beneficial, because often they don't want to seek out those services with the county or with the state or with the National Veteran Service Organization due to cultural barriers or maybe misconception of the services or programs they offer. So these individuals can be trusted individuals, the tribal vet reps from tribal areas who are American Indians and Alaskan Natives feel more comfortable in providing and releasing information to. Thanks.
Here's a question from the audience related to finding and connecting with either tribal veterans representatives or accredited DSOs. They ask, is there a website where you can look up where your nearest VSO is, or what other ways can people who don't know how to connect to these organizations find out where they are?
Hi, yes,
This is Helena.
I'm Sarah Delgord. With the state there, it's listed on their website by county. Also, when you Google other national service organizations, it will identify points of contact within specific areas. And then always feel free to reach out to our office as far as with respect to if there's a tribal vet rep or a tribal veteran service officer within your county or state, either in a volunteer or paid position by the tribe. We can also help make that connection.
I just want to.
I want to plug real fast the Oregon State Department of Veterans Affairs and the Confederated Tribes of Grand Ronde and our office is hosting a 2.5-day tribal vet rep training in Grand Ronde during May 9th through the 11th. And if you're interested, just drop me an email message.
I just want to add that the states of Arizona and New Mexico have paid employees on their staff who are tribal members. Not of each tribal government, unfortunately, but they are tribal members of select tribes, just people who are veterans and who have expressed an interest and then became a state employee, and they work as veteran service officers. And then the Navajo Nation has recently signed an agreement with the state of Arizona to have five individuals trained as VSOs to serve each agency within the Navajo Nation. So there are 5 agencies, and it spans 3 states. So the state of Arizona said, we will provide the training, and we will make sure that the claims that are submitted are, the most correct form possible, so that they don't get returned. Because there needs to be some oversight in the beginning until those veteran service officers become really good at what they do and are conscientious and so forth. Because there's, it's a very important role that they play in taking these claims forward for veterans, because of that there is a high fiduciary, obligation once the claim is satisfied, and there's also just the representation that occurs between the 2 individuals to the VA. So I just want to state that there are tribes who have, or there are states that have tribal people who are on their payrolls and working as VSOs. But as Terry said, if you have questions, please contact one of us in one of our regions. And so this is Homina, by the way.
Thanks, Homina. We've got a comment from an audience member from Hubert Smith, who says, please note that the Navajo Nation Veterans Administration has 4 certified veteran service officers. And then there's a question related to that. Tony Cordell asks, did the Navajo Nation apply to be recognized as a VSO? Homina, I don't know if you have any more information about exactly how those veteran service officers were recognized.
Well, I think Hubert has probably some really strong information that he can lend, because he is in regular contact with those individuals who are acknowledged by the state of Arizona to function as claims representative, as a VSO. So, but it was so each state has each governor assigns a department within their government structure to handle Veterans Affairs, and in the state of Arizona, that job was delegated to Wanda. Wanda. So she's the director of the Arizona Department of Veteran Services, and then she, working with the Navajo Nation, they determined to train individuals to be VSOs, and then the state of Arizona would assume sort of the oversight responsibility until those individual VSOs become adept at taking a claim independently forward.
Great. Thanks, Homina. Let's move to our final topic, which is something that we all like to hear about, best practices and successes. And each of you have areas in your region where you've had some important accomplishments. Go ahead and tell us about what you think you've identified as a best practice or a success from your region.
Okay, this is Homina. I'll just go forward really fast. My colleague, Mary Cully, was asking about the embedded clinics within the IHS facilities and the tribal health program facilities that the Prescott VA, or also called the Northern Arizona VA healthcare system, has with several facilities. And so with that question she posed, the fellow who works for Prescott VA, he wrote to her in response, currently the Chinle VA clinic team has an assigned primary panel of 357 veterans who routinely use their services. In fiscal year 16, this team served over 649 unique veterans. These veterans received VA primary care, specialty, mental health, and or VA HUD-VASH services. Others received assistance with VHA enrollment, the choice program, compensation and pension exams, or home modification assistance. And then he goes on to say that the Tuba City team has a primary care panel of 214 veterans, and in FY16, just over 473 veterans residing in and around the Hopi and Navajo nations were served under this partnership. Veterans received veteran VA primary care, specialty, mental health, and HUD-VASH services, and they also benefited from having access to tribal health program, specialty, and surgical services on site through the Tuba City Regional Healthcare Corporation. So those are actual numbers that he maintains to, at all of the places that Prescott VA has a reimbursement agreement with.
Hi, this is Mary Cully again. And I think for me and my region, some of the things, and while there are so many of them that you could talk about, some of the best practices and some successes that I've probably seen over the last 4.5 years have been where tribes have really worked and embraced several areas. But one in particular for me is their homeless concerns, their homeless needs for their veteran population. In Oklahoma, I've been working with a lot of the tribes here in understanding what a homeless stand-down is. VA does what they call homeless stand-downs, and it's basically for those that have, like Peter and I that have served in the military, you understand that a stand-down in war basically means that you're coming in from the trenches, you're taking a break, you're getting a hot meal, you get an opportunity to get cleaned up, change your clothes, and then you go back out into the field. Well, they've taken that concept for the homeless veteran population, and they call it a homeless veteran stand-down. And what I've been working with a lot of the tribes here in Oklahoma, and I've probably worked over the last 4 years with about 20 of them, where we guided them through the process and understanding how a homeless stand-down process works. And by working with not just our tribal, our VA, our state, federal, and our nonprofit partners, we take what we've done up to this point and we continually build to see how we can make those processes better. By coming to the tribes and asking the tribes as part of teaching them how to reach out, how to help, and how to assist their homeless veteran population, I've also asked them to take the concept, make it their own, make it more culturally relevant for the veteran population that they service. And so I think by bringing those kind of needed services, not to their vets and to their widows, we've been able to make it work. Between the 20 tribes and myself, we've done over the last 4 years 4 different intertribal stand-downs, one each year, and it ranges anywhere from 7 tribes coming together to 8 tribes. This past November, 16 tribes came together to do a statewide intertribal stand-down, reaching out to our homeless population. And over that time frame, I'm glad to say we have been able to bring services to approximately 436 of our American Indian vets here in Oklahoma. Of that number, 77 of those are female veterans, which is astounding because our female vets just do not come in and ask for services. For whatever reason, they don't. But we've been able to get them to come to these events. Same with our widows. We've been able to assist 38 widows over through this process, find them, help them, and then, and in addition to that, they also self-identify themselves as to who is homeless, because that's something else that we don't know, is we don't know what those numbers are, and that's something that's hard to capture. But by bringing that cultural component to it, we're able now to be able to help tribes not only identify who their vet population is, but also identify who their self-identified homeless population is, and provide them needed services. I think probably the best thing for me is that in addition to that, what you're doing is you're getting all these components working side by side as they help this population with these services. We group like services together. Like everybody within healthcare is all in one area. Anybody with mental health, all in one area. Same as housing. So you literally have tribal, state, nonprofit, housing entities working side by side. The key thing that makes this work for the staff is that, if they have a break or they have a moment, they get to talk to whoever their counterpart is, get their information, get their business card. They learn more about what other programs are out there, especially the nonprofit programs, that they can utilize, sometimes not just for their vet population, but for their entire population. And so it's a win-win for everybody all the way around. I'm real proud of how the tribes have embraced this concept, the processes itself, and have really made it their own. And with the numbers that we're getting as far as the vets that are coming out, because a big part of what's really making this work for them is not that they're just bringing their own cultural uniquenesses to the event, but the tribes really come together to focus on what I consider two of the biggest things that make these effective events is the publicity that we do in terms of not just our tribal newspapers, but our tribal TVs, posting where we know our homeless population visits or stays or goes to, but also working the tribes really work together to figure out the best transportation process we can pull together to get the vets from where they are to the actual event and then back, which is a huge undertaking. So those are just kind of some of the things that I consider a huge success and a huge best practice for how that population in Oklahoma has been trying to service their homeless population needs. I think another area for me that I see that is extremely successful is VA has what we call this home-based primary care program. And they're RNs, some of them are physician's assistants, where they basically go into the home, take care of the veterans in their home setting. They triage them. Well, with Asheville VA and with the Jackson VA Medical Center, Asheville out of North Carolina, Jackson's out of Mississippi, they work with their respective tribes in their states, and they have such a great tremendously great working relationship that their offices are housed actually within either their healthcare facility or in an office on the reservation itself. So they have been able to build this tremendous rapport with the tribal staff that they work with, as well as the veteran population, because as we all know, a big part of what gets us to be able to service vets is building that trust relationship. And I think the uniqueness in terms of how they've managed to build their programs into what it is and what makes it special to me is that as the HCT specialist, the home-based primary care specialist to go out and service these vets, they have the ability when they come back and do their clinical notes, they address it in the VA medical record system as well as the tribal health record system. So they put it in both places so that both the VA and the tribal health doctors see the conditions of the vets that these individuals are servicing. And I think for me, and this kind of goes back to the other individual that wrote in and asked about relationship building with local VA. My boss, Ms. Birdwell, had said that, if those instances where you're unsure and you need our assistance from OTPR with helping you establish those relationships, this next success story, in my mind, for me, has to do with one of those collaborative working relationships, and that's with Oklahoma City's VA Medical Center and the 28 tribes that fall within their catchment area. they've embraced the need to understand exactly where their gaps are in relation to what they're not doing locally to service the tribal veteran population. And so every year, the Medical Center Director hosts an annual tribal consultation session with the CEOs and the staff of the healthcare facilities, whether, both IHS and tribal health. And they sit down and using what the VA calls a lean belt process, using that process, they work side by side with the VA staff to look at a specific process that the tribes bring to the table, that the healthcare folks bring to the table, that they consider is a gap or a wall for their veterans using VA or access to VA's healthcare here. They together take that gap or that process, and by doing that together, it's giving these tribes a voice in how VA is looking at and addressing that gap, that wall, so that that veteran doesn't meet that barrier, that wall anymore, and getting the kind of care they need.
Thanks, Mary. I'm going to have to, Mary, I'm sorry. I'm sorry to cut you off, but we're moving close to the end of our webinar time. I need to move us into our time for questions and comments, and also for final thoughts and concluding comments from each of our presenters. So for our audience members who are listening, if you have any remaining questions, go ahead and get them in. We may not have time to address them all, but I will see what I can do to connect them to our presenters. But also take a look here on the screen where we have each of the regional specialists listed with contact information, so you can reach out on your own to connect the person who works for your region. But in terms of closing thoughts from our presenters, I want to ask Terry to go ahead and share what you thought.
Hi, thanks everyone. I just wanted to say, as far as best practices within my region, I think I'm very grateful for the partnership and the collaborations with the tribal governments, because without you, really, we can't move forward with all of the good benefits and services that are out there for veterans and their families. So I greatly appreciate all of the work of our tribal health programs and our tribes and the work that you're doing out in Indian country. So thank you so much, and thank you for allowing us to be a part of that.
Thanks, Terry. Steph, do you have some comments in closing?
Sure. Just in closing, just a couple of very quick takeaways. We always like to recommend to tribes that if you're looking at basically how to shape or how to really where to begin with respect to identifying what the needs are for veterans locally within your local community, two kind of guiding documents, if you will, that might be helpful to kind of inform decision making are: take a look at the VA IHS MOU, the bigger document, which even though it says VA IHS, that book and those chapters are still relevant to tribal health programs and tribes across the board, not just health, but the tribal community. So take a look at that VA IHS MOU document and take a look at that kind of simple one-pager that identifies the different priorities. Those both do a really fine job of identifying kind of at the programmatic level some of the areas that you can look at that may be areas of emphasis or focus in your local tribal community. And we also say, hey, leave in the parking lot things that are not relevant, but maybe utilize and use that to spark conversation with your local VA, state, and other partners with our office to say, this is something that we want to see reflected in our community. How can we use this to guide our communications and move forward? So thank you all for the work that our listeners are doing on behalf of veterans across Indian country. Thank you to our veterans for their service. And again, those two documents, if you want to start with those can take you a long way to where you'd like to be. And thank you so much for listening in today.
Thank you, Steph. That's excellent. And as we're wrapping up today, I would like to remind our listeners that we have a lot of resources available for you in that middle box on the right-hand side of your screen. These are websites for OTGR. These are contact information pages. As we're concluding, please take a look at those and explore them a little to see if they give you any first steps about where to take the concerns that you have for veterans in your own community. In closing today, I'd like to thank each of our presenters for being here and for sharing about the work that you do. I hope that it's encouraged people to reach out to your OTGR regional specialist. I think it makes a world of difference to know that someone's there who can help people find their way among VA's many programs and can help support the work that so many of our audience members are involved in to honor and support the veterans in their communities. So as we're wrapping up this 3-part series on veterans and long-term services and supports, I want to leave our audience with these resources for connecting with the VA in Indian country. Make sure to take a look at the resources in the middle box on the right-hand side of your screen. We've also got a link here to download a VA program's contact information sheet. This has information that we've gathered together from all 3 of our webinars. It covers eligibility, it covers long-term services and supports, it covers VA and Indian Health Service collaboration, it covers the rural interdisciplinary team training, and OTGR contact information. Also, we've got online on the LTSS webinar archive the initial 2 parts of this series on veterans, and you can access that with the link that's right there on your screen. And finally, if you have any remaining questions, please contact us at the email address listed there, ltssinfo@kaufmaninc.com. Thanks to our listeners. Thanks to our presenters. That concludes our presentation for today. Thanks for joining us. And that concludes today's session. You may disconnect now.